and their stockholders. There's a bill in Congress now that would do this. Its number is H.R. 676. It would enact an improved form of Medicare to cover everyone, not a public option for some and private insurance for others. One system that serves every patient. One system that is accepted by every doctor, every clinic, every hospital. One system that pays those providers the same amount for serving the rich and the poor. That's what we mean by a single-payer system. Healthcare is a right. A single-payer healthcare system is how we ensure that right for everyone. Next, we're going to have Nadana Carter from STOP. Nadana.
Hi. I don't know if people are aware that the stats for cancer in the African American and poor communities is rising, especially breast cancer. Women need to be able to be served. If they don't have a clinic to go to, where will they go? If this clinic is allowed to close, many people won't have anywhere to go. The Cook County Hospital and Providence Hospital, which are the two closest, have a more than 6-month waiting list to get in one of their clinics. That's in all of their clinics. People can die in the meantime. Venereal diseases are going up. Where will those women go to get treated? Uterine cancer, the rates for uterine cancer in poor and African American women is on the rise. Where will those women go to be treated? They will not have 6 months to wait. They will die. What will the University of Chicago do? Use their bodies for research? Another thing we must also consider is that the University of Chicago is being given tax dollars through the federal government for that research. If they are being allowed to use tax dollars and you have consumers who are taxpayers dying, then they don't really need to do the research, do they? Another thing we have to consider is that with people not being able to be treated, you're going to have more children whose parents are also not being able to take care of them. You'll have children that will have to drop out of school, children that won't be taken care of, children that will be sick. Not just the women, the children will be sick. It's important that we look as taxpayers at how the University of Chicago is spending money that they are receiving from the federal, state, and city governments. It is important that we as taxpayers have an accounting of where our tax-paying dollars go. If the University of Chicago believes that it's okay not to treat the poor taxpayers, the working poor, every person that goes to the clinic is not on welfare. There's such thing in the United States and especially Chicago as the working poor. Those are the people that cannot afford insurance, but they work every day and they pay the taxes that are accumulated and then given to institutions like the University of Chicago. As taxpayers, we need to ask all of our legislators to investigate how the University of Chicago is spending federal money that they're getting. Because closing a badly needed clinic is a deficit to the city of Chicago.